Hey y'all, my name is Nurse Ryan. I am a weekend on-call hospice nurse. And today in this video, I wanted to talk a little bit about COPD. We have a lot of patients that come to us to hospice with COPD or end-stage COPD. And it's a difficult diagnosis because it's trouble breathing. So what does COPD stand for? Chronic obstructive pulmonary disease. So you usually get COPD from smoking cigarettes. Or you could get it from other environmental things, but typically it's from smoking for many, many years. And what COPD does is it basically damages your lungs to the point where you really can't breathe and you can't exchange carbon dioxide. We have these little sacs in our lung called alveoli, and in normal patients with normal lungs, these absorb all of these little sacs absorb all of the oxygen and are able to exchange carbon dioxide, and so you can get enough oxygen to your body. Well, when you have COPD, all these are damaged, and the oxygen absorption really isn't happening the way it should be. So once they come to hospice, we don't focus on trying to cure anything. We just focus on comfort. And you could have a good quality of life on hospice with COPD. Something we normally do is when we get somebody, we do several different things, several interventions. One is oxygen. We start the patient on oxygen, 2 to 3 liters, just so their lungs will continue to work for the air and so they can have comfort. We use medications like albuterol that help open up the airways, and it really helps. And if you do it with a nebulizer, basically if you fog it into your face and breathe it through a nebulizer, that really helps open up the airways. Other medications we use are morphine. Now, morphine is an opiate, and morphine helps you with shortness of breath, and it somewhat suppresses your respiratory drive to make it to where you feel like you could breathe. Another medication is Ativan. We use that for panic. Anytime somebody is underwater, and this is what COPD patients do, feel like they're underwater and you're trying to get up. Anybody who can't breathe panics. And so we give that Ativan to help the COPD patients not feel like they are in a panic. So we also use prednisone. Prednisone kind of heals the lungs and makes it so you can feel better just for a short time. We usually try to limit moving around, and we ask that you get put a fan on your face so you don't feel so panicked. With a combination of all these medications, usually that really makes it so you can have a decent quality of life with COPD in hospice. We also have to deal with the mucus. So we have patients who have a lot of mucus because it's just you get a bunch of buildup. We use a medication called Levsin, which dries that out, or Mucinex. And so you can have a good quality of life in hospice with COPD. You're not going to be out running marathons or doing anything like that, but you can live the rest of your life in comfort. And so if you have end-stage COPD and you're thinking about hospice, here's just a little video on it. And hospice is there to walk you through every step of the way. So of course, when you're on hospice, you have a diagnosis of 6 months or less to live, but we'll walk you through every step of the way, and you won't be alone. And we'll tell you what's going on. We'll give you the medications. We will show you how to use the medications. We'll walk your family through each step of giving them, and we'll do a bunch of education on what's going on. We really walk you through the day we admit you. We start walking you through all the way to the end of life, and then even when you're gone, we take care of calling the mortuary and take care of the family. So hospice is really a good option for people that just don't have the energy anymore, don't want to go to the hospital, and they just want to be home and be in comfort. So if you have that, I would search out some hospices in your area and ask a bunch of questions and see if it's a right fit for you. So hope that helps. See you next time.